You know, staying healthy is important as you age, along with staying out of the hospital. Here now to make that a reality is Carolyn Richardson and Jody Malamis to tell us more. Thank you both so much for being here.
Thank you for having us.
Thank you.
Yeah, we appreciate it. Why don't we start with telling viewers, we want them to understand how to stay out of hospitals unnecessarily. What do you mean by that?
Well, nationally, up to 25% of patients within 30 days of discharging from a hospital readmit unnecessarily to the hospital when it can be avoided. What happens is they're nervous, they're not staying in the hospital as long as they used to, and they're going back unnecessarily, when that is affecting our Medicare dollars and also can lead to them contracting maybe infections. You want to stay out of the hospital as much as possible.
Absolutely. And let's expand on that a little bit about some of the things that can happen that cause people to return unnecessarily to the hospital.
Absolutely. So a lot of times, like I said, people are staying shorter lengths of time in the hospital. So they're going home a little more sicker than they used to back in the day. And what's happening is that anxiety is making them rush back to the hospital. Perhaps they're not knowing how to take their medications properly. They're going back to their shoebox filled of old medications when in fact they have new medications. Also, just not understanding their new disease process and possibly not getting to their doctor, their medical doctor, in time where he can help manage and talk about their medication and disease process.
So let's talk about the type of services that are available to help a patient leaving the hospital so they don't go back.
Really, what's important at the time of leaving a hospital is a good and thorough assessment of what the patient's needs are, what resources are needed in the home, what support systems are needed, what their environment is like, what they understand about their disease and how to currently manage it versus what they might have been like before a hospitalization.
And let's talk about, should a patient, as they're leaving the hospital, should they expect that they're going to be connected with everything they need to know and qualify for? What would you tell them about that?
Well, I would say that, of course, they're trying to do their very best in a hospital to assess the needs and set up a person for success when they're leaving. But the reality is, when a person's in the hospital, they're there for such a short stay. The case managers, the discharge planners, they're assessing as best as they can, but they don't have a good, accurate picture. When a person goes home, a lot of times that's when you can really see what's lacking or what's needed. So although they're trying their best, it's not always that people are getting everything they need at the time of discharge.
Yeah, and the thing is, they can prevent not knowing and kind of look ahead by calling a PACE care coordinator. How does that work?
Absolutely. I would ask that while they're in the hospital, they can reach out to PACE. They can reach out to a care coordinator. We can initiate a partner, a sponsor such as GAP, social worker, who can go in the hospital with them, start working on a discharge plan to make sure when they discharge, their home is safe and the plan is set up.
Yeah, that's really important, and we're telling people about it now so they know. So, because I am learning so much every time PACE comes on about kind of how to take care of myself. You kind of count on that you're going to go and they're going to tell you everything you need, but actually, really, everyone's moving too quickly, and this way you really have someone who's pushing your needs at home.
Advocating and navigating you through the whole healthcare system.
Yeah, I like that, advocating and also, of course, navigating. Very important. For more information, everyone, to kind of get ahead of it all, just go to seniorhousing.org or call the number on your screen.